My name is Shanti Jenson, and I actually work for a nonprofit called the California Health Collaborative. We're a public health nonprofit. My office is in Oakland, but we're one of over 275 community agencies that have been hired by Covered California to do education for Covered California. So what is it? You might be halfway wondering or 100% wondering. Covered California is a new marketplace for affordable private health insurance. Under the Affordable Care Act, every state was asked to set up a marketplace to make it easier for the public to shop for insurance and to distribute financial assistance to people who needed it to buy health insurance. So in California, our marketplace is called Covered California. There were actually 36 states that decided to share one federal marketplace. That's the more famous one called healthcare.gov. So I think when you think of a marketplace, it's still a little bit confusing. If anybody has ever bought a flight on orbitz.com or travelocity.com, or even if you've ever bought a product on amazon.com, that's essentially what Covered California is. It's an online marketplace like that. The umbrella is Covered California, right? It's a state agency called Covered California, but the products that are sold on the website are private health insurance plans, such as Kaiser plans, Blue Shield plans, Anthem plans, and some other insurance company plans. As far as the Affordable Care Act, I think it's important to point out sometimes still people have a little bit of confusion about Obamacare and the Affordable Care Act. They're the same thing. Obamacare is just a nickname for a law called the Affordable Care Act. And the Affordable Care Act is over 900 pages long. There's many, many pieces to it. One of the most important pieces is guaranteed coverage, which means that nobody can be denied health insurance based on a pre-existing condition. So if somebody has asthma or diabetes or cancer, health insurance companies sometimes would deny them coverage because they would be very expensive to cover. And now health insurance companies aren't allowed to do that. Another important piece about the Affordable Care Act is the financial assistance. Where it says affordable coverage, that's referring to a huge amount of financial assistance that will be available to people who qualify to buy plans. Also, plans will not have annual limits for pre-existing conditions, so they can't just say, oh, we're only going to pay $10,000 for your diabetes or something like that. They're going to pay whatever it truly costs to cover somebody's pre-existing condition. Also, health insurance companies are not allowed to charge people more if they're sick or have a pre-existing condition. And another big part of this Affordable Care Act is that large employers, those employers with 51 employees or more, must provide health insurance to their full-time employees. So that would be large companies like, Target, any large company with 51 employees or more. Small companies with 50 employees or less are not required to provide coverage, but they're encouraged to provide coverage. There's tax breaks, there's tax incentives for them to do so. So this is kind of the goodies here. Starting January 1st, health insurance plans, normal health insurance plans, not like little supplemental plans, but normal ones must cover the 10 essential health benefits. So different states used to have different rules as to what had to be covered on plans, but now this is the new federal guidelines for what needs to be covered. I think some of the ones that deserve special attention on this list are maternity and newborn care, mental health and substance use disorder services, so that would be like counseling and alcohol rehabilitation services, and prescription drugs. Those three tend to be the ones that pop up the most as being services that were frequently not offered before but are now mandated to be offered under insurance plans. Okay. I would also point out at the bottom here, pediatric services. Plans under Covered California are going to offer dental and vision services for children, but they will not be offering dental and vision services for adults. So Covered California, one of the main points of it is to make health insurance affordable to people. This slide kind of familiarizes us with some of the language around insurance payments. So premiums are the payments that people make monthly generally. So the premiums will be based on income. And some people also receive financial assistance for their co-pays. So the co-pays are what people actually pay when they visit the doctor, which is different than the monthly payment that you make, regardless whether or not you visit the doctor. So very low-income people will qualify for co-pay assistance. Many of the plans have no deductible, and all the plans will offer free preventative care, and this is really wonderful. This is the direction that healthcare is moving into. That means colonoscopies will be free, birth control will be free, mammograms will be free, immunizations will be free, women's yearly well woman visits, those will be free. All of that is goodness. And the lower out-of-pocket maximums is to protect people from bankruptcy. So now, instead of people being able to rack up hundreds of thousands of dollars in their medical bills, a lot of times, it really depends on income, but for example, maybe one person, the maximum that they would pay would be $6,500 in a year for their medical expenses. So I think this is the most important slide in the whole presentation because this tells us who actually gets financial assistance. If we look at a family of 4, okay, the left-hand column is the number of people in the household, and this is the household is defined by the way people do their taxes. So this is the IRS definition of a household. So family of 4, if they earn between $32,500 and $94,200 per year, they could get some kind of financial assistance. Now, if they earn $33,000 a year, they're going to get a ton of financial assistance. If they earn $94,000 a year, they're going to get some, but not as much as a lower income family. If a family of 4 earns more than $94,200, they can buy a full price plan through Covered California, but they can't get financial assistance. They wouldn't qualify. If the family of 4 earns less than $32,500, they're going to all qualify for Medi-Cal, which is normally a free or very low-cost public health insurance program offered through the state of California. In other states, they call Medi-Cal Medicaid, but here in California, we personalized it and we call it Medi-Cal. Another thing really important to note here is for a family of 1, a single person, if they earn less than $15,860 per year, they're going to qualify for Medi-Cal. They do not need children to qualify for Medi-Cal. That is a huge change starting January 1st. That is the expansion of Medi-Cal or Medicaid that you guys may have heard of. Also, they don't need to be disabled, right? The old rules for Medi-Cal were that you needed to have kids or be disabled to qualify. And now all you need to be is a low-income person to qualify. So this slide shows that the healthcare services available to people will really vary depending upon where they live. So, for example, Anthem has a huge provider network, and they're going to be available in all of these counties. Blue Shield is also huge, and they'll be available everywhere. But if we look, say, in Sacramento County, at the bottom there, Western Health Advantage, that plan is not going to be available in San Francisco County. So residents of San Francisco County, when they pull up what will be available to them, it won't be every single plan that's available under Covered California. It varies by region. And of course, at the bottom, we can see Medi-Cal is offered all across the state. This is the second most important slide. It's taken me many, many times of explaining this slide to really be able to get it in a nutshell here. So the plans offered under Covered California will be offered under 4 levels: bronze, silver, gold, and platinum. Bronze will be the cheapest tier level offered, and platinum would be the most expensive. It just goes up in price from bronze to platinum. If somebody chooses a bronze plan, it won't cost very much per month. Again, it depends on income. For a very low-income family, let's say it could be $5 a month. It could be very, very affordable. But because somebody is not paying very much, they're also not getting quite as much from their plan. Okay, all of these plans cover the 10 essential health benefits. All of the plans, doctors who serve clients under all of the plans will get paid the same. But the prices between bronze, silver, gold, and platinum are really expressing the difference between what the customer pays. So it's really the difference between what the customer pays versus what the insurance company pays. So if somebody is paying $5 a month, say, for a bronze plan, a low-income person, their plan will cover 60% of their medical services, of the cost of their medical services, and they will still be expected to pay 40% of the cost of their medical services. That means they're going to have higher copays and they're going to have higher deductibles, maybe a $5,000 deductible. Okay, but they're not paying very much per month. So if they got a platinum plan, they would pay a lot more per month, maybe for a low-income person, maybe $100 or $200 per month. That's quite a bit of money for a low-income person. But their plan would be paying for 90% of the cost of their medical services. And the customer would only be paying for 10%. So they would have no deductible at all, and they would be paying very small copays. So it's really their choice. I suggest when people have health conditions where they need to visit the doctor frequently, it's going to be a better deal for them to get a gold or platinum plan, okay? Because the cost of all those co-pays can add up really quickly with a bronze or silver plan. It's just going to, if they do the math, it'll be cheaper for them to do gold or platinum. If somebody is very healthy and they rarely go to the doctor, maybe 0 to 2 times a year, it'll be more cost-effective for them to get a bronze or silver plan. Apart from that, low-income people can get more assistance for buying a silver plan. And we'll look at that in a minute. Okay, so as far as the prices of the plans, those are based on your age, your zip code. It's not precisely your zip code, but your rating region, so the region that you live in. For example, people who live in LA have access to many, many hospitals, so that drives prices down. People who live in an area in Northern California where there's less hospitals per square mile or whatever, it's going to be a little bit more expensive for them. So prices are also based on your household size, your income, and the health plan, like whether you buy a Kaiser plan or Anthem plan, and then the benefit level, which is the bronze, silver, gold, and platinum. Luckily, rates are no longer based on whether you're healthy or sick, whether you're a man or a woman, if you have a pre-existing condition, or whether you use tobacco. So those are all happy changes that Obamacare has brought. So when people apply to Covered California, they're going to be asked to provide this information, their social security number, information from their W-2s and their income taxes from the previous year. And it's pretty easy. A lot of times people won't have to mail this information in. They can just have it in front of them and read it over the phone when they apply. And the enrollment counselors will just the computers will electronically verify the information with the IRS and with like 5 other huge government agencies. But some people, there's special scenarios where they have to mail in information, like with residency and things like that. But generally, the process is streamlined. As far as enrollment, every year, it's going to be normally October through December. So let's say in June, somebody hasn't gotten any health insurance and they want to sign up. They're not going to be able to sign up for a Covered California plan because it will be closed enrollment. The only way that they could sign up during closed enrollment is if there's some kind of special circumstance. For example, if they lost their job and then as a result lost their health insurance, that would be a qualifying event for them to be able to sign up. Also, we can see up here if they got divorced or had a child or something like that. And good news is that Medi-Cal applications will be accepted year-round.